parents can choose what works for them, and based on their area, what providers are on the same wavelength. This is the challenge. So who's actually looking at expanding a 4-year-old? Not many, but you can find them out there, and that's growing, that's changing. A lot of times it's the tongue trying to posture forward to open up that airway space. It's a subconscious thing that you do. Our bodies are amazingly resilient and adaptable, so we will do things to breathe, and it's subconscious. Like, we're not choosing to do that, it's just happening. If you have a baby or a kid with these issues, you've got to find the right providers. And it's hard, but it's the reality, unfortunately. I wish that you could go to any dentist and they would know what you're talking about, and all the hygienists would know about this, but that's not today. Hopefully that's within the next 5 to 10 years, but it's not the reality now.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 210. My name is Andrew.
And this is Michelle. And I cannot believe we're at 210 episodes. Official episodes, at least.
You know what's interesting, too, is I was looking at someone else had posted one of their episodes that is a hygiene podcast. And I can't remember if it was Irene or Sandy or Jasmine or someone. And it was like episode number like 50 something. And I'm like, how did they have 50 something already? And I'm like, oh, because they've been doing it a long time too.
Yeah.
And we've all been doing this a long time. Yeah. And this is like, it goes so fast.
It really does. Especially when you put one out every week. I mean, that's just crazy.
Oh my gosh.
Yeah.
Oh my gosh.
So I want to talk with you for a minute about who would be a PETA patient, pain in the ass patient for you.
Well, I think that I'm actually probably more go with the flowy than a lot of people.
Say it ain't so.
But the people that I have reactions to that maybe I don't actually say I have reactions to, but I really do have reactions to, are the ones that tell me right off the bat, I'm too sensitive. You're not allowed to use ultrasonic. And I'm like, first of all, in my head, this is all inner Andrew dialogue, monologue, whatever. And I'm like, don't tell me how to do my job ever. Yeah. You're not allowed to do that because my job is to get you healthy. I have tools to do that. You don't get to tell me what tools I get to use. Like, there's no profession that I can think of that you are allowed to tell the professional of it how to do their job. I can't, like, you don't go to your, like, you're doing construction work and stuff, like they're renovating your house. You don't tell them, you know what, that wood that you're using, it's not good enough. I want this other type of wood. That nail that you're using is not good enough. Use this other type of nail or screw or whatever. Like, you don't do that.
Oh, you should see me when my contractor.
Okay, you're not helping me make my point, and I would like instead.
I am the PETA. My point. I'm the PETA patient.
You are the PETA patient, but
in life
for everybody.
Just in life in general.
Yeah. So that's the stuff that kind of makes me frustrated. Where they're like, "Well, you can't use that," and also I don't like those scrapey thingies. I'm like, well, okay, then why are you here? Like, what do you want me to do for you exactly?
What's your conversation look like then with them?
In a very nice way, I say, well, let me just do my assessment first, the paracharting, and we'll see how we're at. And while I'm doing that, I kind of check in. I'm like, how you doing with sensitivity? Is this metal scraping bother you? Does it not? Does it not? And if they have recession and stuff, I'll actually use my probe and I will kind of scrape that recessed area just to gauge what their tolerance level is. Because my feeling is a lot of times I'm not going to be using ultrasonic on exposed root surface just for funsies. I will use it if there's a reason to, which I think you and I might have maybe a different outlook on that one. And then as I'm going through, I'm like, okay, well, how did you do with that one? Okay, you're good. Well, let me just try it. I'll turn the setting down really low and we'll do all these other spots and I'll do the safe spots, right? So, kind of, you're not going to do like the recessed areas again. You're going to maybe not do the anteriors, but you'll do the linguals of the lower posterior. Like, those are never sensitive. And so, like, you'll start there. How's this going here? Maybe do the palatal. How's it doing there? And once you kind of built some confidence, I don't know how many times they said, well, I don't know why it didn't work before. Another thing we do too is, so we have, I don't know, it's Dents by Sirona, but it's Cavitron. It's the 30Ks, right? As opposed to the 25K. And I explained, I was like, hey, we just went through an upgrade. We just bought all these brand new instruments. It's been about 1.5 or 2 years since we've had them now. The faster vibration is supposed to make it more smooth, less sensitivity, all of these things. I kind of explain the science behind why it's better now than it was in the past. But I get the same thing when I'm doing local anesthesia too. When people are like, wow, that's so much better than I've ever had. Well, part of it's technique. A lot of it's technique.
Yeah.
But part of it too is like we have sharper needles. Like everything is better. So if I can put it onto the technology being better, people buy in really easily.
Yeah. I would say I always find out why. I love to find out the why behind it. Is it, that they can't lay back? That's what kind of triggered this conversation for me, was that I read, actually, it was kind of like 2 message boards that I saw. And they're like, what do you do when your patient can't lean back? And of course, there was an onslaught of comments of all over the board. Some good, some bad, some, I was like, your patient's a lucky one. And I keep going back to what is the why. There is a reason for their fear or objection or snippiness, right? If they're not able to lay back, please stop saying, how do you sleep? Like in the way that you're just assuming that everybody lays on their back and stays that way, because most people with sleep apnea, they don't. Like they sleep on their side. Maybe especially if it's positional apnea, they sleep on multiple pillows. They have CPAP machines pushing air into their throat and their lungs to make them breathe. We are not doing that for them when they're laying back in the chair. So please stop saying that and actually dig into what the reason is for them not wanting to lay back. Is it back pain? Is it, loss of control? Is it also the vulnerability of it? We don't know what has happened to them in their, lives. Maybe being laid on their back and have something hovering over them causes some fear for them. You don't know. And the other thing too that I learned at a few of these sleep courses is that when people's airways start to close, it creates a subconscious reaction. Like they don't understand why their adrenal glands are pumping. They don't understand why their autonomic nervous system is kicking in. And so they get afraid. And then that fear, because they can't even identify what's causing it, becomes snippiness with us, right? And then we get snippy back with them. And there's this perpetuating problem and no one's asking the why, what's going on. But if they can't lay back, maybe we need to have a conversation, because that there's a bigger health concern that we could identify and have a discussion about and maybe get them treatment for. I know that doesn't really necessarily figure out what we're going to do with them in that moment in the chair. Maybe you are standing for that appointment a little bit more. But I think if we could identify the reasons, have that conversation, talk them down off the ledge, they would have so much more trust in us and we would be so less frustrated with them. I'm thinking too, for your patients that you're talking about, the scalar, the scraping, all of that. I'll be very frank. Now, after we went back to Australia, I think scaling teeth is the most antiquated thing that we do. And I know I trigger a lot of people. It triggered me when people first started saying that to me way back at Europerio to 2017. The first person that said, you shouldn't be scaling a tooth, your goal is to get to biofilm management and that's not done with a scalar. And I was like, who are you? Get out of here, non-hygienist. Move it along. I don't need to hear anything that you're saying to me. And now that I see that most of the world that are controlling biofilm are not doing it with scalars, I truly now see that we are performing antiquated things. So I'm like, hey, let's do something else. Or let's talk to you. What experience did you have where that wasn't uncomfortable or you didn't like it? Or, I like to talk to them about it and figure out why are they pushing back? And immediately in the chair. And I had that happen. I think I've said this before because, my students are rotating through my outreach program now. So they're my colleagues. They're my students at the school when I do teach, and they're my colleagues where I'm seeing patients, which is a very interesting dynamic. And apparently they had a Sonicare water pick person come and, everybody gets on that bandwagon once they leave, right? They just learned this new information. So they're really excited to talk about it and they tell all the patients about it. And this patient sits in my chair 6 months later and he's all grumpy and I don't want to hear about your water pick and your Sonicares and your things. And I was like, my initial reaction was eye roll, great, this is going to be a real fun one. And I took a step back and I was like, tell me what the issue is. Did you try that and it was unsuccessful, or like, just talk to me about it. You seemed a little frustrated with that. He was like, I live out of my van. I don't have any electricity. I don't have any running water. Like, I don't need you to talk to me about these things that I can't afford. And I was like, you know what? You're right. Like, we did not engage you in a conversation apparently at all and meet you where you're at. And so I'm really starting to move past these PETA patients and see them as crying for help. And like, what can I do as a healthcare provider with all the random knowledge that I have from all these courses? How can I help them? Because some of them are truly crying for help, especially the airway people, especially the ones that can't sleep and are just in chronic disease and chronic state of not being able to breathe. That's all I wanted to say about that.
No, I like it because it puts what we do kind of like a human perspective on it, because I feel like we do get that way. We do end up being
it's so easy too, especially
right, because we are the experts. Yeah. We know the things, we know what's right and wrong. And then like, we're also into this hierarchy of the dental office where, you know, the dentist is the top, the owner, doctor, whoever it ends up being. And then we are, you know, right below, and then the assistants, and then all these, you know, there's a whole hierarchy that happens. And we're just playing into that hierarchy even more by making the patients feel less than us. But if we would just stop for just a minute, talk to them, get to know them a little bit, get to know their, like, what is their living situation. You don't have to get like real personal with people.
Right.
But I mean, especially during the holidays, it's really easy to find out what people's living situations are and who's the players in their life very simply. And just, yeah, like you said, getting down to their level and then giving them the tools that they can actually use to be healthier. And sometimes it's incremental health, right? Maybe it's not a total reformation.
Yeah, I agree. But I just wanted to talk about that because I think we see it on Facebook, and then we are like, oh yeah. And then we kind of go into our vents and our rants and all the things that we do. And that's not really helping anybody. And I always want to just like bring it back to, what if it was you and your child, right? And that was the nurse or the doctor treating you like that and pushing back on you and not being willing to listen. And the moment that you wanted to lay back in a chair, you couldn't do it. And they were like being kind of rude about it, like, or not understanding your fear and your trepidation about a lot of the parts of the appointment. And I do like your perspective of like, let's put it back to the technology, you know? Mm-hmm. I have new instruments. We just got these really cool things that were FDA approved in October that Europe's had for a while. And now we have this, and it's super exciting. And I think you're just going to like be blown away by this appointment. Like, bring it back to the technology, and also that, this isn't costing you any more money during your appointment, but this is how much we value caring for our patients, because we're going to invest in that to make you more comfortable.
Yeah, I love it.
Yeah. So this is part 2 of the Myofunctional series, part 2 of 4. And I think you guys are really going to enjoy this as we kind of get into it with babies and newborns and tongue ties and kiddos. There might be some things that trigger you too. You might be hearing some maybe things you've done or you see done, or maybe you believe the opposite. So I would love to hear your feedback after this. I definitely have a 4-year-old nephew that's struggling with the pacifier right now. And I literally want to burn all passies. Like, I don't care what kid has them. I want to burn them. Like, he's got so many facial development issues I can see. And hearing things like this podcast just makes me lose my mind. So I hope you enjoy part 2 of this Myofunctional series with Sarah Hornsby.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
So listeners, welcome to episode 2 of this airway series with Sarah Hornsby. Thank you for coming back on with us.
Yeah, you're welcome.
So last week we talked about just kind of your journey, getting into Myo, where I first learned of Myo, and also kind of the history of myofunctional therapy and all the different professions that could be utilizing it. And we learned that it doesn't belong to anyone, but that's kind of where I want to start, is with the application of myofunctional therapy. And I think a good starting place is babies, right?
Yeah. Yeah. And I should make a caveat. Like, I know a lot about this stuff, but I am not a mom. I do not have babies myself. But it's been amazing what I have been able to learn over the past almost 10 years that I've been in this field, and like these little nuggets of wisdom that I've taken away, that even though in my practice, I don't work with a lot of babies personally, what I love is that when I'm working with a mom and their like 8-year-old, a lot of times they have a baby or a toddler or someone, you know, a younger sibling that I can give them advice about, but I don't necessarily work with them. So, but yeah, any age, I think the younger we can get to this stuff, the better. So with babies, it really starts with understanding breastfeeding. And I know that's kind of a controversial topic, but, I wish, and this is the one thing I can tell you that moms tell me all the time, is that if they knew that breastfeeding was more, or was not only about the nutrition, so pumping and bottle feeding, so many moms don't know, like no one ever tells them that breastfeeding is all about muscle and jaw development of the baby. So that tongue movement, the jaw, like if you watch a baby's mandible, all those early breastfeeding, that is really what develops the mandible and the muscles and the function. And again, it's no judgment. It's just, I don't think moms know this. People think, oh, if I just pump, a baby's getting nutrition, and so it's all good. But there's a whole component of that muscle development and jaw development that you're missing if you bottle feed. So that's...
Yeah, I've never heard it put like that.
Yeah.
And my sister's a lactation consultant. I'm going to have a big conversation with her. And can I just share with you an experience that I just had with a friend of mine? Because your caveat was, I'm not a mom and I don't really work with babies. And that's often my caveat to a lot of things when I approach people. I don't have the babies and I really don't like working with kids.
You're funny.
I definitely gravitate towards the geriatric adult population. So in some of these courses, they start talking about kids, and I'm not sitting in the course like, la, 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 I don't hear it. It doesn't apply to me. But I gotta maybe zone out sometimes because it's not something it's not applicable to my current life, right? But I always pick up on these little tidbits like what you just said. And I'm like, oh, well, that's interesting. So recently, one of my friends for many years, she had a lot of trouble having a baby and conceiving, went through a lot of IVF, and finally, after years, had a little baby girl. She was born premature. And this happened, I think right around the time that you and I both went to Australia for separate reasons for some of the courses. And so by the time that and my surgery and things like that were happening. So it took me probably like 6 to 8 weeks to get to this sweet little baby and see her and welcome her to the world with my friend. But what I knew is that she was having a hard time as a newborn. She had terrible acid reflux. She was choking and gagging. Like when I asked her about what was going on, like she couldn't swallow and was having trouble like just with saliva. And my poor friend was like sleeping upright with her through the night, like with her just laying on her chest because she was so afraid to put her back. And now all of a sudden, by the time I get to her, she is on all kinds of medications. They're thinking that she's got a syndrome, and I can't remember what the syndrome was, but they were going to start testing. And I'm spending hours, like me and my other girlfriend come and we sit with her. She's about to get off maternity leave, and I sit with her. We're drinking wine. We're there for hours. We're enjoying this day, and I'm holding this baby because as much as I don't want them, I love to steal them from you.
Yeah.
Give them back after a few hours. And I'm holding her and I'm watching her, and her tongue not one time goes to the roof of her mouth. Not one single time. And it's not an obvious tongue tie on that straight anterior of the tongue. Mm-hmm. And I can't get her to open. And I'm like, I don't know. Again, we talked about this in a little bit on the last podcast. Like anybody who is around me is always like, oh, Michelle's always up to something. So I'm trying not to push this new little knowledge on my friend.
The crazy friend.
Or go stick in my hands in this new baby's mouth because I don't really know what I'm looking for. And I'm like, I know I'm not going to like call her out, but I'm telling my friend, I'm like, listen, I really think you need to go to this pediatric dentist. I know they do tongue tie therapy in here in Charleston. I would love for you, just please. I think this might be what's wrong with her.
Yeah.
Why she's having a hard time.
Or even the lip ties. I mean, for babies, it's amazing. With breastfeeding, they're supposed to get a really good flange on their lips. And if their lips are tied and they're like, you can see me, but they're like
Thin
rounding,
lip, yeah.
Or they're rounding their lips under versus like the lips flanging, like flaring out. They probably have a lip tie and they're not able to get a good latch. So these are little tidbits that I tell to moms and I talk about. But, like I said, the muscle and jaw development, that's really missed. The fact that like babies are fine in most hospitals and with most lactation consultants if they're gaining weight. They're like, oh, they're tongue tied, but it doesn't matter. They're gaining weight. And what people don't realize is that restricted lingual frenum, it's going to change that path of jaw growth potential. So if the tongue physically can't get up into the palate to push that maxilla forward, to get the mandible to follow, and to get, the nasal breathing and lip seal early on. I mean, these things happen within the first days, weeks, months, years of life. I mean, the earlier you can get this stuff functioning correctly, the better. A tongue tie and lip ties will definitely challenge breastfeeding. They will be obstacles for optimal cranial, facial, and airway development. And this, if moms knew, I think people wouldn't just think of tongue ties as like the scary procedure you're going to do to a baby. In reality, it's very simple. And the earlier it's done, the better. Like if you can get a tongue-tied, lip-tied baby done within a couple of days, and then they can just latch and they can breastfeed. Breastfeeding is myofunctional therapy for babies. It's like, it's meant to, gosh, I wish I knew the exact statistic on this, but I just heard Tracy Nguyen talking about it. But so much of our mandible development happens in our first year of life because of breastfeeding. And it's crazy. Like, I don't remember ever learning this stuff in dental hygiene school. And
I don't remember that from embryology.
No. And exactly. And I just remember learning about tongue ties was kind of like, oh, you just mark in the chart, like within normal limits, like even if they're like full anterior tie. So now if you look at it from a functional perspective and jaw development, dental development, airway development perspective, now you can start to see why tongue ties are such a thing. And there's one comment I'll make on this too, that I learned from Dr. Ben Miraglia, and he is an airway dentist. I think he's based out of New York, but I heard him on a webinar, and it was the first time I had always heard like a lot of these changes are epigenetic, it's like takes generations, like, we see these things happening and then within 3 generations, they're really bad. The babies being born today in the US are 7th or 8th generation, soft food, all of the stuff that I was talking about on that last podcast. So 7th generation, he was saying that by the 7th generation of introducing these environmental factors that can influence us epigenetically, it's a 95% or 98% chance that you're going to have these. And that's where the babies are today. And that's why we see so many tongue ties. We see so much crowding in anterior or primary dentition. Like baby teeth should not be crowded, but they almost always are.
That's what we would love to see.
Yeah. Baby teeth should all have spaces in between. And that's super rare. Like now we see baby teeth that are actually crowded. And a couple generations ago, you didn't see that. So it's really amazing. And people should look up Ben Miraglia because he's got a lot of knowledge on that stuff. And then also the tongue tie stuff, Dr. Richard Baxter, he's down somewhere in your area, Alabama, South. I mean, not by Charleston, but he's got a book called Tongue Tied, and he's really focused on the infant. So if people want more resources, Dr. Richard Baxter is great. There's a lot of good resources. There's also a lot of controversy with tongue ties in babies because babies are fragile. They're delicate. You can't just not know what you're doing and go in and just, you have to really respect like how fragile and new to the world babies are. And like, if you don't know what you're doing, like don't deal with it, like refer. And if you're a mom, find someone who really knows what they're doing. There's really scary stories that get publicized all over, like a baby died from a tongue tie surgery. And then that goes crazy in the media and stuff like that.
That comes with that.
Exactly. And so it's like, okay, if you look at the backstory of those situations, they're like insane. I mean,
right.
It's like, it's not the norm. So I don't know what you want to kind of delve into on those topics, but there's a lot.
So to end cap, my friend's story is that they went and got that tongue tie clipped, fixed, so whatever, however I don't know what the correct term is for that.
Either.
And baby B is thriving within days. Within days.
Gosh.
Because by the time I followed up, I was like, hey, have you gone to see that doctor? And she goes, oh, we've already went. It happened. She sleeps through the night. She eats no problem. Like, she's good. But my concern and some of the things that I heard is that even at 8 weeks, doing a surgical removal of that tie, there needs to be exercises with it. Am I correct in understanding that?
Sometimes. So there are stretches. And if you look on Dr. Baxter's website, he has a lot of infant stretches. And I think it's important too to know, I mean, the best, and this is, again, there's so many just like controversial things. I think CO2 laser is the best. I don't think diode laser on babies is good. That's just my opinion. People would argue that. But if you understand like what's happening with diode versus CO2, one's a hot tip and one's an actual laser. And the pain and the healing process is much more optimal and the procedure is quicker with a CO2 laser. So I think that is just helpful for people to know. I don't know. There's probably different types of CO2 lasers. I don't know. I'm not a laser
sure there
expert.
are, and I'm not a laser expert. But
I do know that diode is much more, the healing it takes longer and the procedure is slower. So there's much more inflammation in a baby that, can make all the difference with reattachment. Tongue ties reattach easily. And so breastfeeding is the number one thing for babies after they have the tongue and lip ties released, but then also, stretches. So every doctor has different recommendations for stretches. So, some people have them wake up babies all through the night, every 4 hours, like they have to do these stretches. Some just recommend it during the day. I kind of refer to the doctors on this. I don't like to contradict what they tell the patient. So, but stretches are helpful. I think babies under 8 months tend to do a lot better once they get big enough. Like they're not really breastfeeding. They're getting teeth. They're too big. Like it's hard to swaddle like a 10-month-old or a year-old. Like, so for the procedure on the infants, they swaddle them. Their arms are all bundled up. They can't, move. They cry, which is really sad. They cry. And then it's done. And then they breastfeed and they're like good to go. But there is a window of age where I think it's really hard on parents and kids. It's like basically 1 to 4. That age group, like they're usually not breastfeeding, so they're not getting exercises that way. They have teeth. It's hard for parents to get in there and stretch. And they're too young to do actual myofunctional exercises. So I always tell parents in that window, just be prepared. Like you can make a decision. 1, release it today, see what benefit you can get, but expect that it might reattach to some extent and you might have to do it again later when they're 8 or 9. And that's fine. Just don't tell parents it's the end all be all. I think just be upfront with people and then they can make the decision. Or you wait and you get into an early intervention orthodontist who can start actually doing something at 4 years old. Like I work with doctors who are doing expanders in 3 and 4 year olds because they can see, and that's rare, they can see these challenges and they see, oh my gosh, this kid is so retrognathic. This kid is like, they're so crowded and so narrow and they're 3 and part of that can be the tongue tie and the mouth breathing. And so I think parents can choose what works for them and based on their area, what providers are on the same wavelength. This is the challenge. So who's actually looking at expanding a 4-year-old? Not many, but you can find them out there and that's growing, that's changing. So,
and then if they have limited resources, you can't really get to that practitioner, unfortunately.
I know. So this is where it's really cool. Like the online support groups that are popping up on Facebook. I run a myofunctional therapy support group and I have a lot of the hygienists who've gone through my mentoring program. They're all on there kind of like moderating it so that I don't have to as much. But there's a tongue tie support group for babies, a tongue tie support group for like kids and adults. And there's a lot of helpful information as far as like finding providers and connecting with people who don't necessarily advertise. But there's a lot of crazy stuff on there too, like parents telling other parents like what to do. And it's like, sometimes you should probably ask your dentist or doctor about that. But, that's the internet. So
got it. You're so right. That's the internet. As much as you want to police it.
Mm-hmm.
Yeah. So I want to go back to kind of square one, as far as things that we can maybe identify in our own babies, our loved ones, our friends, or, even if a patient's sitting in your chair and they brought their newborn or their 8-month-old or something, maybe we can talk about the conversations to have. I know you're experienced, but if you were a newbie, what are some of the things that would trigger you? Like open mouth, like
definitely.
that breastfeeding curled under. Like, tell me some of those things that can make my eye start twitching. I'm like, I see it.
Yeah. So babies who are struggling to nurse or they're not sleeping well, like you said, your friend was going through that. So nursing problems, weight gain issues, even just watching the latch on breastfeeding. Are they getting a deep latch? The nipple needs to be like far in. It shouldn't just be like just barely in. And there's some really amazing videos on this. I've taken some lactation courses, so it's not like I don't know anything.
I was going to say, you sound like you know something.
Yeah. And the lips they should be like flared. Like I wish I could, show the picture of that.
But I'm sure, do you have it on your YouTube?
I don't, but there's two great resources that I always direct people to. Diane Barr, she's a speech pathologist based out of like Las Vegas, and she is all about infant feeding. She's got some great books, amazing resources and stuff. And she's like, this is her area. And then, Michelle Emmanuel, she's also trained in myofunctional therapy, but I believe she's a occupational therapist. And she's all about babies and tongue ties. And she's actually the inventor. Have you ever heard of something called tummy time?
Yes. Does she have the Instagram tongue tie babies?
I don't know. I'm not sure.
I'll look that up because I follow that one. And that's why I'm always like,
yeah, exactly. So
enough to be annoying to be
totally. So looking for feeding issues, acid reflux, sleeping issues, and then mouth open posture. Babies should be breathing through their nose. And when they're asleep, they should be breathing through their nose. So moms can so easily just push their little like chin up, push the soft spot under their chin where their tongue would be, and get it to you can get the tongue to push up. And if they're not tongue tied, it should form a palatal suction. You can seal their lips and you can position them while they're sleeping to guide that growth and breathing and stuff. So, there's things you can do. And I think just knowing this stuff, knowing about tummy time, that's a really important thing. I'll send you some links. I follow she's a physical therapist or occupational therapist on YouTube. She's got amazing videos I always send to people. And it's all about like tummy time with a newborn through I think a year or something. So like babies, what do you do? So tummy time is super important, and it really relates to tongue ties, because if they have a tongue tie is basically tight, restricted fascia in the whole midline, like the deep front line of the body. And fascia is a whole new area of research and understanding. Like we always kind of thought of it as it's just the stuff that's in between the muscle and the skin. And, but fascia is we're discovering it's like a communication system. It's almost like a second nervous system. And when we have these tight restrictions in our fascia, which a tongue tie can be one itself, but it can lead to others, especially as you're an adult and you compensate because of a tongue tie. These fascia restrictions are very limiting and they cause problems in our bodies. So tummy time helps stretch that front line for babies. And so when they're on their tummy and they have to learn to lift their head, it's an amazing exercise that they really need. So learning to get babies to roll, to do all these things. There's such great resources. So, but I think, the feeding is the main thing. You can, I can look at a baby and I can see if their lip looks really tight, I can usually tell just because I've seen enough of them. There's a certain look to lip tied babies where they almost look like it looks tight to me. It should be loose and kind of rolled up. But if it looks rounded and tight, that could be an issue. But mouth breathing is a big one.
So the tummy time method is that?
Tummy time method. Yep. Michelle Emmanuel. Mm-hmm.
That is who I follow on Instagram. And that handle is tongue tie babies for anybody that.
Oh, cool. Okay.
This is somebody you were like, oh, I want to know more. And the thing that she said, and I was so interested, these are little tidbits, again, as a non-mom, but somebody in the world long enough, breastfeeding. Yeah. Got it. Nutrition. But then you just added on to that. Tummy time.
Yes.
I've known about tummy time. I've done tummy time with a lot of babies. But this said, it's not just doing tummy time that matters. It's what's done in tummy time. And
cool.
that I was like, oh, that makes sense. Like, what's actually happening? What are we accomplishing? It's not, because I always thought it was like neck strength,
Yeah.
right? Like, let's get them to hold their head up and
Yeah. They play, they engage, and there's so much that we don't even realize. Like, and I think this is a whole different topic, but I know I see Michelle Emmanuel posting on social media about this cell phones and what they're doing to like our interpersonal relationships and family dynamics, and especially with babies, because they're looking at you to make that facial contact to connect with them. And when we're all zoned out on our phones and stuff, it's like, I don't think we realize what the consequences of this will be, but it's amazing, like how young these things start. And, what you do during tummy time, it's so important. So,
oh, that's a good point, because I just also saw on the good worlds of Instagram, somebody was setting up a nursery setup, right? Like, this is your nursing station setup. And again, what do I know about a nursing station setup?
Yeah.
But
me too.
in the chair was a phone charger.
Yeah. So apparently a lot of moms, I would do too, probably, if you don't know,
I would
like,
too.
of course you're going to do this. You look at your phone while you're breastfeeding, but for like generations and, thousands or millennia, however many years, moms have been eye contact, like connecting, bonding with their babies while they're breastfeeding. And if you're looking at your phone while you're breastfeeding to pass the time, like there's a whole like missing link there with like connecting to your baby that is probably not good,
Yeah.
So
you and I learned havening at the
we learned that. Yeah.
And how just that stroking of the forehead and just under the eyes and then
the
that
arms,
particular order and sequence, how that is so great for the baby, but you can't do that when you got a phone in your hand.
No, you can't do that. So again, I'm not judging. And like I said, if I didn't know this stuff, like me and you are just kind of like health nerds, like we're like I look into all this crazy stuff. And so I know about a lot of stuff. I wouldn't say I'm an expert in a lot, but I know about a lot of it. And then I see things like that. But if that wasn't my personality, I'd probably be doing that too. So, I
agree. So coming back to babies and things, can we talk about acid reflux and all the babies that are on acid reflux meds? Is that a swallow, fascia, tongue issue?
I think it is a lot more than is getting recognized. Yeah. So I think, if you think about when the tongue is tied and it can't actually function correctly, babies who nurse, they take in a lot of air. And apparently you can hear it. Moms talk about hearing clicking or gulping, or the nursing is loud and it doesn't sound right. But basically they're gulping down air into their little bellies, which is, I think, common to some extent. But when it's to the point where like their stomachs are just, they're spitting up all the time, they're getting acid reflux, like there's something going on there. So I do think there's a high correlation of, even in adults, myofunctional symptoms and airway symptoms being connected to acid reflux and GERD, and even something called LPR, which is silent reflux. That's laryngopharyngeal reflux disease or something. This happens. Yeah, it happens at night. This is in adults and kids, but it might happen with babies. I don't know. Stomach acid comes up into the nose and into the mouth, and people don't even know it's happening. They don't wake up and think, oh, I have heartburn, but we can see acid erosion on the teeth, and they can do like ENTs can do like bacterial swabs and stuff, and they see stomach acid in the nose. And it's all connected to, I know it sounds so disgusting, right? But it's really connected to that dysfunctional breathing and swallowing and probably tongue ties, but there's a huge correlation. So I think any baby who has acid reflux or is put on acid reflux medication should definitely be screened for a tongue tie, or lip ties.
So I noticed a picture the other day of a baby and their little tongue was just like outside of the mouth. So it wasn't tied. It didn't, not to the point where it's tied down to it was just hanging, kind of pushing forward and just falling out of the mouth. What am I seeing there? Is it just their tongue's too big for their little craniofacial setup?
Maybe to some extent. But what you could be seeing too is, think about like what a mandibular advancement device does. It brings our jaw forward, or it brings the tongue forward to open up the airway. In some cases, and I never like to make blanket statements because it's obviously going to depend on the baby and all that.
Yes.
But A lot of times getting the tongue out of the airway means sticking it out of the mouth or resting it between the teeth. That's why we see open bites. That's why people who have a tongue thrust, a lot of times it's the tongue trying to posture forward to open up that airway space. It's a subconscious thing that you do. Our bodies are amazingly resilient and adaptable. So we will do things to breathe, and it's subconscious. Like, we're not choosing to do that. It's just happening.
What do we talk about? Like, what could that answer be? Is that a myofunctional answer? Or
if the baby's posturing the tongue, like, so it's like literally sticking out the lips, you see the tongue outside the mouth, that's just, they're just hanging out like that. Yeah, it's probably some sort of, I would be like, okay, what's going on? Like, if this baby can't breathe very well, is it
a nasal obstruction?
Nasal obstruction, tonsil adenoids, a ton of babies. This is actually good for people to know. Not all babies will have acid reflux. A lot of them will get ear infections and ear tubes put in their ears. So tongue ties and ear problems are directly linked along with adenoid issues. So that is, I think, a triad of problems that people don't realize are all connected. If you can't swallow correctly and optimally, when you swallow, you should hear a little click in your ear. That's your eustachian tube draining. It's releasing fluid. And if babies can't get that to happen through nursing and swallowing because of a tongue tie, that fluid builds up. They get ear issues. And then the adenoids are all part of, it's the same. It's all so close together in there. The adenoids are often inflamed and swollen as well. So, and then the baby mouth breathes because they can't breathe because of the adenoids. And so it's just this whole big problem that can often start with a tongue tie. So
holy antibiotic stewardship, though. Like,
I know.
If we could identify some of these things and help a child early on with some kind of therapy versus the repetitive amount of antibiotics that these poor little babes are going on in their little gut microbiome.
I know, exactly. Yeah. So speaking of gut microbiome, another interesting thing, and this will take us down a whole different rabbit hole, but I don't know if you've heard this about like babies who are born vaginally versus C-section. They have different immune system set up, because what we're discovering is that when you pass through the birth canal, you get inoculated with the mom's bacteria. And it sounds really disgusting, but it sets up your microbiome for life. It's reality. I mean, that's how it works. It sets up your microbiome for life. And babies who don't pass through that, so C-section babies are more likely, and I think there is a hormonal component that I can't remember either, but babies who are born via C-section are more likely to have allergies and asthma and respiratory issues, and therefore myofunctional issues as well. So, man, there's so much. If you're a mom, I mean, if I'm ever a mom, gosh, I'll be like so stressed. I know too much.
Right. Again, we know too much to be annoying to others.
Yeah,
at least
totally.
I am to most of my friends and anyone who wants to talk to me for 4 minutes.
It's
but that is really interesting, because I'm making assumption, because again, I don't work with babies and I don't work in this labor postpartum world, but it feels like C-sections in some cases are about convenience too.
Totally.
Like, right.
Mm-hmm.
And even just like the convenience foods and pumping and which again, no judgment. Like sometimes that just is what it is for a lot of people. You have to do what's right for your lifestyle too. But
it's more about knowledge to me. I mean, if people actually knew, if they knew like, wow, like the C-section, it seems convenient. I can have it on a due date, but if you knew that you might be setting your kid up for more like a higher chance, you can't guarantee it, but a higher chance of having respiratory issues and, allergies and stuff, maybe parents and moms would be like, oh, well, if I knew that, that would inform my decision. And so then at least they can, I don't think there's anything wrong with these things. I mean, we need bottle feeding in our society. We need C-sections. So like,
right.
I'm definitely not saying we all need to go back and like, live in the woods and like be all natural.
Birth them out in the bush somewhere.
Yeah. But I think there are realities that we should know, like as advanced as we are with modern medicine and dentistry and all this stuff, like there's things that have just been happening that are natural things that I think when you think about like breastfeeding is like the most natural thing you can do. Childbirth is the most natural thing you can do. Like the further we get away from that, like it kind of makes sense if you think about it, like what's natural and how far have we veered from that?
Mm-hmm.
It's super interesting. So I just think education is the key. Like if moms know, they can make a decision and that's it.
So can I take a step into a bit of a controversial topic?
Sure. I feel like some of this already is. So
I know we probably triggered a lot of people, but pacifiers.
Oh gosh. Yeah, definitely.
One thing that I learned though, because again, me and my all non-parenting knowledge, I was like, ugh, y'all with your pacifiers, could you knock it off? Like, it's not that hard. Of course it is that hard.
Yeah,
I 100% know
is.
that. 3 nephews into this, I understand it. But what I didn't know is the reason behind and the dopamine release that happens in that premaxilla. Is that correct? Yeah.
Yeah. It
that
is.
actually is that self-soothing action. So it's not about like just shove something in the mouth so they can't cry. There's actually something happening when you stimulate that palate.
There is. And I think there was just an article that was released on that because I had heard that kind of like, just, folklore or whatever. But I do think there was actually just some sort of article or study or something talking about it. Do you know it?
I don't.
No, but there is. I was
this
just
with Julia Worrell and even
Yeah.
her Airway podcast too.
Cool. So I'll have to quote Dr. Dan Hansen on this. We were talking about him earlier. He's a dentist in Australia who's like very into the tongue tie stuff, the breathing stuff, the myofunctional stuff, the early intervention orthodontics. And he does a lot of infant frenectomies in his practice. And he says when he lectures, he's like, pacifiers should be prescription use only. And we just give it to everyone. So he's like, there are babies who have like legitimate reasons, like preemies. I think, there is a certain age, like before 3 months, babies need it. And there's a certain age when they should wean away from that. And so he was saying that these things are needed, they're necessary, they're helpful in some cases, but it shouldn't just be like a blanket thing that we do to our babies. Like, oh, here, every baby gets a pacifier. So he said, he's like, if I was Prime Minister of Australia, that's the first law I would pass is that, pacifiers would be prescription use only. And so, it does change. I mean, the palate is so malleable. We see it with thumb sucking. You can get the buck teeth, the narrow palate, the vaulted palate. But even babies, like you can see, if you look in a baby's mouth who's had a pacifier for a long time, you see a bubble palate. And it does affect the shape of it. It affects the tongue posture. It affects the lip seal. The one thing I can tell you that it's good for is, your baby can breathe through his or her nose. If they've got a pacifier in, they're nasal breathing. So sometimes I think it's a sign if kids won't take a pacifier, like my little niece, she wouldn't take one. She had allergies and she just, her parents, my sister was kind of proud, like, oh no, she's never wanted a pacifier. I'm like,
oh, that's
because she can't breathe through her nose. Yeah, she can't breathe through her nose. So of course she doesn't want a pacifier. That's like, no, now you can't breathe at all. So I think that might be a good thing for parents to know if their kids don't want one. It's just uncomfortable. Maybe there's more going on, but there's a certain age. I don't know what it is. It's not, like my area of expertise, but I believe it's 3 months and under. Like it's actually a pretty needed thing for soothing, self-soothing. Even thumb sucking is fine at that age. Maybe it's better. I don't know, but yeah, then it's supposed to kind of fall to the wayside. So. And a lot of that falling to the wayside is from the tongue going and stimulating that area where the pacifier stimulates. So that's where the tip of our tongue should rest. And every time we swallow, we should get that dopamine released. But if you're tongue tied or if you're mouth breathing, your tongue's not going up there. So you're not getting that release. And that's why kids will want their thumb or they'll want blankets or they're trying to look for that soothing feeling through putting the other things in their mouth. So.
Wow. This is so good. This is so good. So let's talk about sleep with babies and the tongue tie concerns, because you brought that up. And I also then would love for that to flow into what does it mean with craniofacial, you said it earlier, development, I think it was.
Well, so it goes back to like a lot of that epigenetic stuff where for whatever reason, environmentally, food, all these modern things that we're doing apparently are causing epigenetic changes. And there's a couple books if people are like, oh my gosh, what are you talking about? That sounds crazy. There's a book, The Dental Diet by Dr. Stephen Lin. There's a book by Dr. Sandra Kahn called Jaws. And there's a few others, maybe Gasp by Michael Gelb. These are books.
Just finished that one.
Yeah, they're talking about all of these things and the connections, and especially jaws. I would say that one's really talking about why are human jaws and skulls changing. So if you guys want to look that kind of stuff up, your listeners, again, it's rabbit holes.
Yeah.
So, but with, wrap it around back to your question again, because I'm getting there.
Sleep.
Oh yeah.
What could disturb a baby so that they don't sleep or don't sleep well if they have tongue tie issues?
As our jaws are getting smaller, our tongues have less space. So even babies, we're seeing like a lot of babies, their mandibles are small. That, like, you know, like I said, we're 7 or 8 generations in from having these modern diets and modern environmental influences. So babies are born a lot of times with smaller jaws, and then they don't breastfeed. And so it's really just creating this ripple effect. But the tongue is a big part of the airway. So if the tongue is falling back, if they're tongue tied, if they're congested because of allergies or whatever, there's so many things that can affect a baby. So if you hear a baby breathing heavy, snoring, if they're really restless, tossing, you know, like they're just, depending on the age, I mean, they might not toss and turn when they're like an infant, but if they're fussy a lot, not sleeping through the night, but like they're not hungry, they're, you know, like you can't soothe them. A lot of times these babies are very sleep deprived because every time they start to get into REM sleep and all the muscles relax, the tongue goes and, you know, is interfering with the airway. And a lot of babies actually do have sleep apnea, not a lot, but I think it's like, it's higher than we think. It's like 1 to 4%, which is 1 to 4 out of 100. And that's more like the severe. I mean, that's full on obstructive sleep apnea. But I think there's estimates as high as like 25% of all kids, including babies, have some form of sleep disordered breathing. And then if you add in mouth breathing, which is a form of sleep disordered breathing, mouth breathing alone at night will affect your sleep. So then we get into like the 70, 80% range of potential people who are affected by this stuff. So all this sleep disordered breathing stuff, it starts when we're really young and it only gets worse as we age. So that's why I think being aware of this stuff and correcting early, you know, getting the lips together early, getting the tongue up early, if that includes a tongue tie release, you know, do it early, breastfeeding as much as possible, you know, setting up our babies for good growth and development. And then knowing, even if they do have these symptoms, it's not too late. You can find an early intervention orthodontist, hopefully, who can start to guide some of that growth when they are 3 or 4 and getting a little bit older. So those orthodontists and dentists are popping up everywhere now. And it just takes some Googling and some, you know, it's not, you can't just go to the dentist down the street and expect like, oh yeah, they're going to know about this stuff. This is where I think we've had to become our own healthcare advocates, and moms are going to have to go out and do a lot of research on dentists. You know, if you have a baby or a kid with these issues, you've got to find the right providers. And it's hard, but it's the reality, unfortunately. I wish that you could go to any dentist and they would know what you're talking about and all the hygienists would know about this, but that's not today. Hopefully that's within the next 5 to 10 years, but it's not the reality now.
I think it's interesting that if you don't identify that tongue tie and it forces that mandible to be kind of heavy and weighted, and then you mouth breathe, and then that's a sleeping disorder. But also what I learned about that is that when you open your mouth and that is your primary source of breathing, it changes your autonomic nervous system.
Yeah.
And how
we go into
really,
fight or flight. Yeah,
exactly. That sets up so many other, I guess, would neurological issues be? I'm not sure if that's the exact pathophysiology thing that happens, but it sets them up for anxiety and things like that.
Exactly. And if you're not sleeping well and your body's in fight or flight mode while you're trying to sleep, I mean, you're definitely, I know that sleep disorder breathing symptoms have a big overlap with anxiety and depression, because depression, I mean, at least what I've learned from a lot of people smarter than me in this area is prolonged anxiety becomes depression. So if you're anxious for years and years, eventually it's like your body can only take so much and it can transition to depression. I wish I could remember who I learned that from. I just thought that was amazing. But there's such a high correlation, and it's really hard to say like, if you have A, then you get B. And so we know that a lot of these things are all connected, like the cardiovascular stuff. There's all these comorbidities, but it's almost like a syndrome or a collection of symptoms that people have versus like if you have A, you get B, it's not that linear. But yeah, the myofunctional and airway stuff, mouth breathing, anxiety, it's all connected. So, and the mouth breathing, it does trigger our stress response. So our sympathetic nervous system, it kicks us out of the autonomic, rest and digest type of response. Mm-hmm. Parasympathetic, I guess.
Parasympathetic. Yeah. So my thought is like, if you are a hygienist in peds, like you have, you're in that, you love it.
You're in the trenches with that stuff.
And how exceptional would it be to have this? Because I mean, scaling on a child, I mean, God, that seems horrible to me, but I'm sure it's happening all the time. But what kind of significant impact you could have with an entire family.
Yeah.
If you are a pediatric hygienist with this information and capabilities to perform the recommendations and the exercise. It's almost like you just have this audience just sitting there waiting for you.
Totally. And I'm getting more and more interest from pediatric dentists and pediatric hygienists and stuff. I always can kind of gauge it by who reaches out to me and like what's their background. And I think the pediatric space surprisingly has been a little slower. I don't really know why, but I am starting to see more and more pediatric dentists. I think just because it's really hard. I think those people who are healthcare providers on the front line with kids, there's so much to talk with parents about, and parents are so stressed about so many things that it's just like another thing, and it's a really big thing. And so I think it's just hard. Like it's really hard. We don't have systems. We're talking about switching an entire paradigm of dentistry. Like it's not how dentistry works. Like anyone who takes this on, and I always give a little plug for all the doctors who do refer to me, because I tell patients, you found a really awesome doctor. It's so much easier to just keep doing the same thing just go through all the years. Anyone who's implemented airway and myofunctional stuff into their practice or into their referral network, it's the hard path. It's much harder to tell a mom of a 3-year-old that they need to release a kid's tongue tie and look up a myofunctional therapist and go check out the tonsils and adenoids. And it's so much easier to just focus on the teeth and do they have cavities? And, that is easier. There's already so much, but to go down that whole path, and it doesn't financially always make sense for the dentist. This is one struggle that, we're all in healthcare because we care about patients, but we all also want to get paid. It's a business. And so it's not super profitable, depending on the setup for a pediatric dentist to go tell patients that they need to do all these other things. And then there's a chance that like, well, that dentist was crazy. Like no other dentist has told us to do that. So we'll just find someone else. So I know they have that fear as well. So,
yeah. So in the last 5 minutes or so, I would love to talk about the conversations. How can you start them? Because you just said it's a huge paradigm shift within our industry, but I can't imagine what that shift feels like and how you approach it within parenting.
Yeah.
Especially when they're in survival mode.
Exactly. So I think, there's always going to be some parents who they want to do all the reading and all the research and all the learning, and they will find me. Like they will do, they'll read every blog, every YouTube. The conversation's not hard with them. I think the conversation is challenging with the parents who are just so busy, they're frazzled, they're stressed. There's, especially when the kids do have bigger issues, like maybe they have sensory issues. They have, I shouldn't say bigger, but perceptively bigger. Like who cares about mouth breathing when my kid is autistic, But I always tell the hygienists who mentor with me, just plant seeds, drip information, and don't think that people are just going to be jumping up and down. Like you tell them about this stuff and they're like, oh, awesome. How do I sign up? Some will, but others are skeptical. They need to read more, so find out, how do they like to consume information? Would a book, like recommending a book or giving out a book in your practice, would that connect with some people? Some people love YouTube videos, maybe following up with an email, like here's a playlist of really great YouTube videos that explain this stuff. Again, I don't think a lot of dental offices do that kind of thing, but
or Instagram account.
Why not? Instagram. Yeah. Find the right Instagram people to follow. If you start looking into this, there's a lot of information, but you have to point patients in that. If it's a brochure, if it's they have to kind of take ownership as well, which is hard because it's a big change. It's hard to get your kid to go through a therapy program. It's much easier to say, here's a medication, or, we just need to have that surgery, but we can't do the exercises for the tongue tie stuff. So yeah, I think it comes down to connecting with people and educating and just knowing that not everyone's in the place yet to absorb that information. But if you give them the information, then you can check in with them every time they come back in every 6 months or whatever. And hopefully at some point they'll be ready to hear it. I think that's the best we can do.
No, I think you're absolutely right. And that's a lot of things in dentistry, right? Like we have to drive it to our patients. We have a tendency to fire hose information at our patients a lot of times. I'm absolutely guilty of that. The other thing is the one thing I've learned, and I've been practicing for a few years now, is asking permission to give information. Good. And, even just when I start my appointment, I always ask permission. Can I lean you back? Is that okay? Can I let you know if I find anything in your mouth that maybe could be changed with home care recommendations? Asking permission before just because they sat in my chair is not permission to
that's true.
Throw information at them. Miranda Beeson actually has a term called, she's like, your patients aren't information receptacles. They're not your trash can for all of your information. No, that's
so good. Yeah.
It's really good. And even asking that of your friends, can I have permission? I'm noticing some things maybe that's going on with while you're breastfeeding, you've been sitting here having a conversation with me and I see that the baby's struggling. May I have permission to share with you some information that I just learned, or I just listened to this great podcast? Can I share some Instagram accounts or a brochure with you? I think asking permission is a huge thing, because if they're like, no, honey, I don't need any of your advice. I'm not in that place to hear it, right? I'm not there. And you're not wasting your time. And for me, the follow-up is I've only had one person that's like, no. And that just happened. I am in 2 years of asking permission. No one has ever said no to me until recently. And it was because they were just having a really crappy day. And they were like, I just need to lay back in this chair. And I'm like, noted. But when you are ready for it, I would love to share this stuff with you. And, I haven't had them for recall, but I suspect that they're going to ask if they come back.
Yeah.
But I think that's a good thing to do for your patients and friends and family.
Yeah. And just, I always am I had that experience. I talked about it on the first episode, where people, I was the example of the person with these issues. And I know that kids, even if they're really young, we all are self-conscious if an adult points something out that is I don't want to be that adult. I can remember when I was 8 years old, a dentist told me I had really big teeth. I remember that, my front teeth were big or something. And I just don't want to be that adult that plants seeds into a kid's, psyche that something's wrong with them or, any of that stuff. Yeah. And so I'm very careful, especially when I'm working with kids and the parents are, asking about these things. And a lot of times my therapy is really all online these days. And so a lot of times I'll say, it's okay. You are free to go. I'm just going to talk with your mom and dad for a little bit. And then I'll go into more of the, what I see visually, or I try to make the conversation about health versus about appearance and that kind of thing. So I do think you have to be careful with information. Nobody likes to feel like something's wrong with them either. And sometimes they think that they're fine. And then you're the one who comes and points out all these things oh, you have all these problems. So I think we do have to be careful as healthcare providers, just giving people information in a nice way or a helpful way and not in a way that's just going to make people just not feel good. So anyway, that's kind of my approach. I'm sure there's people with other better approaches, for them, but that's for me. So
I think that's a good point. I actually just came from a retreat where we talked about shaming and shame more in the professional environment, but it definitely is applicable to our patient care. And as you shared with us in the first one, they're oh, mouth breather and long faces and flat, cheekbones and circles under your eyes. And you always look tired and you're like, well, damn, I didn't know any of those things. And now how do I get out of bed? Because I'm a horror. I look like Shrek. I don't know.
Yeah, totally. Or Napoleon Dynamite. That's what,
Yes. So how can we have those conversations where, like you mentioned, that's a great point, is like, it's about health. It's not about appearance. It's about functioning well in your body. So this was really good. Any final tips, maybe something that we didn't touch on in the world of babies?
Again, be an advocate for your baby and for your toddler. Like, unfortunately, not all pediatricians are going to know this stuff. So if you have a concern, reach out to a lot of different background professionals. Like, I wish I could just say, just trust your pediatrician or your doctor. They know everything, but unfortunately they don't. And I think a lot of moms, they have the best intention, but they're like, well, the pediatrician said the tongue tie was fine. And so we just left it. And now 3 months down the road, we're having all these problems. And so, do your own research. And if you feel like something's wrong, trust your gut and don't be afraid to reach out to other professionals to help you, whether it's lactation, even chiropractors. A lot of like the more holistic, naturopathic type of background people, they're really into this stuff. And I think we forget that sometimes. So reaching out to other professionals and practitioners can be really helpful, and build a team, find a team of people who can support you and help you, because we just don't, everything is so separated in healthcare that sometimes you might have to talk to multiple people. So if you have the resources, at least, do what you need to do, on your own. Unfortunately, I mean, I hate to say that, but it's kind of true. So.
You're right. And my friend from the beginning of this podcast, they said they noticed that tongue tie when she was born and said, as long as she's feeding and gaining weight, and nobody said, oh, they put that poor baby on medications and we're about to diagnose her with a syndrome. I can't even understand it. But
it's one thing I do hear moms all the time. They know, like, moms are like, I knew something wasn't right. Like, they have this like mom intuition. Like, moms know, and they're like, I think it's the lip, or I think it's the tongue. Or I've had so many moms say, like, I knew that my kid mouth breathing, like, it just didn't seem normal. And I asked the ENTs, I asked the pediatricians and the dentists, and everyone said, oh, it doesn't matter if you breathe through your mouth or your nose. It's fine. It doesn't matter. They'll grow out of it. And, these moms, they know early on. And then, they're talking to me and they're like, I knew this 5 years ago, I knew it. So
true.
Yeah.
This has been another great episode with you, Sarah. Thank you so much. If, again, this is something someone's listening to as a one-off, know that there was one before this and there are going to be more after this. So keep listening. But if they only hear this one, Sarah, how can they find out more information about you, from you, and maybe even take a course from you?
Yeah, you can find me on Facebook, on YouTube, on Instagram. If you just look up Sarah Hornsby, you can find me. I've got 3 websites. One is for my practice. That's myfaceology.com. That has a lot of just patient information on there about myofunctional therapy. One is my online platform for my mentoring program. That's sarahkhornsby.com. And then the other one is more informational, but I'm working on joining these together. It's myomentor.com. So you can find me. I mean, honestly, if you Google Sarah Hornsby, I'll come up. So
you're everywhere, YouTube and all.
Totally.
Well, thank you again for all of this information you're sharing with us and your expertise. We do appreciate all of this and your time.
Yeah, thanks for having me.
So I'm interested to hear everyone's feedback after this. There was one thing that Sarah did want to mention, that she wants to make sure that she wasn't throwing shame on anyone, especially when we talk about when you're breastfeeding and you might be on your phone while you're doing it. And that, if that's what you're doing, that's what you're doing. She doesn't want to shame anybody, but there is some science to show that it's a harder time to connecting with the baby, and the baby, they want to mirror and they want to see you. And I've heard that from Julia Worrell for years, like looking them in the eye and making that connection and like rubbing on their head and their fingers. And, it's hard to do when you're scrolling through Instagram, but not throwing any shame, just highlighting the point.
What's really interesting is when we're talking about lip tie, tongue tie specifically, especially after last year's stuff, is, look, I worked in a pediatric office right when I got out of school. I knew it was a thing. We did a lot of like frenectomies and things like that. Like, that was a billable procedure that we were always looking for, always doing, because our dentists, our doctors were looking for that particular thing. Yes, partly because it's a billable procedure and they make money out of it, but also because they're pediatric focused and they understand what the long-term ramifications are. And so now I'm working in like the general practice, and over the last probably 15 months or maybe even longer, it's been identified multiple times where I've had to talk to my doctor about it and be like, hey, this is what I'm seeing. This is, they're 7 years old, they're 6 years old. This, like, how do you feel about this? And I asked them, and a lot of times they're like, yeah, I don't do that. And so I drop it right there, because there's no point in like pushing them into doing something that they're not comfortable with, or they don't have the education behind. Because you don't want, are you going to start doing stuff that you don't have an education behind either? No, it just doesn't happen, right? So it planted a seed, and one of my doctors finally came around to that, and they started looking into it a little bit more. They took a couple of courses, and boom, they started
great
addressing it. But they used, I don't know what the tools are for everything, but they use electrosurges, and it worked out in their particular area. I know you made the face, like, yeah, but that's what they were taught on, though, right? So maybe if they take more courses and they learn newer techniques, then they'll start utilizing those. But I was very happy. But it's also something that like I can identify. I can take it to my doctors and put it back in their hands.
True. It's a very good point. I identified it in she was 19, I think, something like that. Anyway, not to give too much patient health information out, but she definitely was struggling with sleep, and it had never been an issue. And actually it was her mom that before, she's like, she's always late. She's always sleeping in. And I was like, and then I saw her and I was like, honey, this is not your this is not your fault. It's not your fault. This is a bigger issue, and we need to get you some help. And that was fantastic to identify on her, especially after hearing her mom complain about her. So we're hoping you are enjoying this series on myofunctional therapy. If this is, you're just tuning in for this series, we would love for you to subscribe or hit the favorite or add whatever apps you're using out there. If you have been enjoying this or have been enjoying it for a while, we would love a review. We would love a rating on iTunes or actually any of the apps that you're using, but especially if you're an Apple user, that would be fantastic. Also, you can go over to Instagram and like our page. We are going to be doing Instagram lives, and we do chairside chats where I'm talking about certain products. I would love for you to send your questions if you want to learn about anything in addition to stuff we're talking about on the podcast. Let's do it on Instagram, and subscribe to our newsletter. If you're on our website at taleoftwohygienists.com, hit that subscribe to the newsletter, or you can text ATOTH to 66866. And this is just, January 2020. That might change later on, guys. So I don't know if you're listening to this 2 years from now, probably just safe to go to the website. But right now you can text that to us, which would be great. We hope everyone has a really great week, and we will talk with you next week.
Bye, everyone.
Bye, y'all.